There's a conversation that happens in doctors' offices every single day that most patients never fully hear. A person comes in worried about their thinning hair. The doctor mentions finasteride, one of the most prescribed medications for hair loss. The patient goes home, looks it up, and finds something that stops them cold. Sexual dysfunction, decreased libido, erectile dysfunction, and in some documented cases, side effects that persisted for months or years after stopping the drug entirely. So they do nothing, because the side effect profile feels like too high a price. And meanwhile, the thinning continues. What most of those people never discover is that researchers have been studying a plant-based extract derived from a small palm native to North America that works on the exact same biological mechanism as finasteride. Not as powerfully, but in clinical trials, with real results, and in studies without the side effect burden that makes so many people walk away from pharmaceutical options. Today we're covering what the published research actually says about saw palmetto, the clinical trials, the honest numbers, what it can and cannot do, and how it compares to the prescription options most doctors reach for first. If you haven't subscribed yet, the bell is right there. The next video covers the internal nutrient deficiencies that most standard blood panels completely miss, and that may be silently shutting down follicles regardless of what you apply externally. Worth watching before you spend another $1 on topical treatments. But first, let's talk about why so many people hesitate on finasteride, because the conversation starts there. Finasteride is a 5-alpha reductase inhibitor. That means it blocks the enzyme responsible for converting testosterone into DHT, the hormone that drives follicle miniaturization in the most common forms of pattern hair loss. It works. The clinical evidence is strong, FDA approved, widely studied. But the side effect profile has been a legitimate concern for decades. In 2011, Dr. Michael Irwig at the George Washington University School of Medicine published a study in the Journal of Sexual Medicine, PubMed PMID 2014-145, that documented something the pharmaceutical trials had largely understated. He interviewed 71 otherwise healthy men who had taken finasteride for male pattern hair loss and reported new-onset sexual dysfunction. The numbers were striking. 94% reported low libido, 92% reported erectile dysfunction, 92% reported decreased arousal, and the average duration of those persistent side effects after stopping the drug was 40 months. Important context: this was a self-selected group of men who were already reporting problems. It doesn't represent every user of finasteride. Most clinical trials show that sexual side effects affect a smaller percentage of users and often resolve with time. The picture is genuinely complicated, and the medical community continues to debate the scope and permanence of these effects. But the hesitation is real, and it's legitimate, for a significant number of people, especially those in their 30s, 40s, and 50s. The risk-benefit calculation simply doesn't land in favor of a daily prescription with that kind of documented potential. That's the gap that saw palmetto research has been trying to fill. Saw palmetto, the scientific name is Serenoa repens, is a small fan palm native to the southeastern United States. Its berries have been used medicinally for centuries, and for decades, researchers have been investigating what the active compounds in its extract actually do at the biological level. Here's what the research has established. Saw palmetto extract contains fatty acids, particularly beta-sitosterol and a specific profile of free fatty acids that inhibit 5-alpha reductase, the same enzyme finasteride targets. It does this non-selectively, acting on both type I and type 2 of the enzyme, compared to finasteride, which is selective for type 2. The inhibition is measurably weaker than finasteride. Clinical studies show saw palmetto reduces DHT levels by roughly 25 to 38% at therapeutic doses. Finasteride, at its standard 1 mCi daily dose, reduces DHT by approximately 60 to 70%. That difference matters. And anyone selling saw palmetto as just as good as finasteride is not being honest about what the research shows. But weaker does not mean ineffective, and the side effect data tells a very different story. In 2012, researcher Alessandro Rossi and colleagues published a 2-year randomized comparative trial in the International Journal of Immunopathology and Pharmacology. They studied 100 men with androgenetic alopecia, the most common form of pattern hair loss, divided into 2 groups. One group took 1 milliliters of finasteride daily. The other took 315 milliliters of saw palmetto extract daily. Both groups were followed for 2 full years. The results were honest and instructive. In the finasteride group, 68% of participants showed improvement in hair regrowth. In the saw palmetto group, 38% showed improvement. Finasteride won by a meaningful margin. But here is what the study also showed. The saw palmetto group demonstrated real, measurable improvement compared to baseline, not placebo-level results. Actual regrowth in nearly 4 out of 10 men, without the sexual side effect burden documented in finasteride trials. The author's conclusion was careful but clear. Saw palmetto could be considered a valid approach for treating mild to moderate androgenetic alopecia, particularly for patients who cannot tolerate or do not want to use finasteride. That's the honest framing. Not better than finasteride, not the natural cure. A documented alternative for a specific population with a specific risk-benefit preference. The research didn't stop there. A 2020 systematic review published in Skin Appendage Disorders by Evron and colleagues at the University of California, Irvine, analyzed 7 clinical studies on saw palmetto for alopecia. Across those studies, 60% of participants reported improvement in overall hair quality, 83.3% showed increased hair density on investigator assessment, and 27% showed measurable improvement in total hair count. Those numbers come from multiple studies across different populations, which makes them more meaningful than any single trial alone. More recently, in 2025 and 2026, a series of randomized, double-blind, placebo-controlled trials published in the Journal of Cosmetic Dermatology evaluated a proprietary bioactive fatty acid extract from saw palmetto, standardized specifically for its 5-alpha reductase inhibition profile. In a 180-day trial involving 60 adults with self-perceived thinning hair, the active group showed significant improvements in terminal hair count in both anterior and posterior areas compared to baseline, and significant improvement compared to placebo. Both men and women were included. No serious adverse effects were reported. This newer generation of research is important because it uses more standardized extracts, which addresses one of the long-standing criticisms of earlier saw palmetto studies, where variability in product formulation made it hard to draw consistent conclusions. So, how should someone actually think about using saw palmetto? The form matters significantly. The research that produced the most consistent results used standardized oral extracts, typically 320 milliliters daily. Not raw berries, not low-quality capsules with unverified fatty acid content. The active compounds are in the lipid fraction of the berry extract. Products that don't specify standardization of free fatty acids are unlikely to deliver the same results seen in clinical trials. It is not a fast intervention. The Rossi 2-year trial showed meaningful results over that time frame. Expecting visible changes in 4 to 6 weeks is unrealistic based on what the evidence shows. Hair cycles operate on a timeline of months, not weeks. It is most supported by evidence for mild to moderate androgenetic alopecia, the gradual thinning pattern driven by DHT. For other types of hair loss, autoimmune, nutritional, stress-related, the mechanism doesn't apply in the same way, and the evidence doesn't support its use as a first response. And it is not a replacement for a conversation with a doctor. Someone with rapidly progressing hair loss or significant thinning should have a proper evaluation before choosing a natural supplement over a pharmaceutical option that may be more appropriate for their specific situation. The honest summary of where saw palmetto stands in the research is this. It is the most studied natural DHT blocking extract available. It has published head-to-head trial data against finasteride, not marketing claims, but peer-reviewed research. It produces real results in a meaningful proportion of people, and it does so without the sexual side effect profile that has made finasteride a difficult choice for so many. It is less potent. It works more slowly. It requires a standardized, quality extract to match what was tested in clinical settings. And it works best when the underlying cause of hair loss is DHT-driven miniaturization, not every type of thinning. For the person who has looked at the finasteride data, weighed the risks, and decided it isn't for them, saw palmetto is not an empty alternative. It's a documented one, with real trials behind it, real limitations in front of it, and a safety profile that the research has consistently supported. That's the difference between a supplement marketed on hope and one that has actually been tested. If this framing was useful, drop a comment. Have you looked into saw palmetto before? Or have you been hesitant about finasteride for exactly the reasons covered here? Those responses help shape what this channel covers next. Everything here is for educational purposes only and does not replace individualized medical advice. Hair loss has multiple causes and requires proper evaluation. Before starting or stopping any treatment, natural or pharmaceutical, talk to your doctor. See you in the next one.